us know that 2020 was a bad year globally and as a country because of COVID. And Ghana as a country put in place certain measures to contain the spread of the virus. One key thing that was done, of course, is about vaccination. So what Send Ghana in partnership with PTF did was to monitor the COVID vaccinations. We have what is called the National Deployment Vaccination Plan, which is a protocol that has to be followed. And so we sought to really monitor to see to what extent health personnel at the vaccination centers were actually following the NDVP. Another was also to assess citizens who had gone to vaccinate, their experiences as to how the vaccination went, whether they were satisfied or otherwise. And of course, once we do that, we also had to focus on certain specific groups, health workers and teachers. Remember that during the COVID period, health workers were prioritized and then teachers were also prioritized in terms of vaccinations. So we wanted to also find out to what extent the prioritization did work. What we established in terms of the findings and then talking about some key recommendations was generally citizens we interviewed during the exit interview session were very satisfied as far as COVID vaccination process were concerned. And we're talking about the extent to which the time was very short. Unlike certain vaccinations where you go and you spend countless time, this one, most people indicated was less than 10 minutes. And so they were generally satisfied also with the attitude of health personnel. And so what we are saying to Ghana Health Service is that if your staff do well, you need to commend them. And so we think that Ghana Health Service should really commend all health staff who actually were in charge of the vaccinations. We are also saying that we realized in the key findings that the protocols were strictly followed, albeit the fact that some were really not followed, but generally the protocols were followed. So we are also saying that yes, Ghana Health Service should commend the staff for following that. But it's important to also have refresher training so that as you train people, compliance level will be much higher than even what was established by the results.